Good morning, everyone. We are some of the nurses here on this floor, and we have a policy that we want to introduce today. We've been working on it for a little bit, but before we begin, we would like to start off by introducing ourselves. So I'm Amber.
I'm Callie.
I'm Spencer.
I'm Sailor.
And I'm Jasmine.
And we'll start this off by having Jasmine introduce the policy statement for the JACSS Memorial Hospital.
It is the policy of the JACSS Memorial Hospital to provide optimal care to patients coming in, leading to healthier and safer patients, which will decrease hospital costs. And today we'll be going over the different procedures to make that happen.
So today this policy really focuses in on pressure injuries, and so we would like to have this procedure decrease the incidence of hospital-acquired pressure injuries. And this procedure will apply to all departments with patients that are going to be admitted for longer than 24 hours.
So just a little bit of background on hospital-acquired pressure injuries. When patients have pressure injuries in the hospital, their mortality increases twice that of a normal patient. They generally have a longer hospital stay, and the hospitals have to pay for all of the treatment that they receive to help them with that pressure injury. That's because of the 2014 Affordable Care Act, which made it so that these pressure injuries were considered never events, things that we as hospital staff should be able to prevent if we're following the recommended interventions. And we have found in research that when we accurately assess patients with the Braden scale score and we find them to be at higher risk, that our nurses are more diligent in putting in place those interventions that we have to prevent those pressure injuries. That increases patient satisfaction, patient health, and decreases the funding that the hospital needs to treat these injuries.
So to put it simply, our policy is pretty much a protocol to put on at-risk patients. So how it would look is any patient who is coming in to be admitted for longer than 24 hours, the nurses are required to do a thorough skin assessment and a Braden scale risk assessment within the first 24 hours. So patients who are found to be between a 13 and 18 on the Braden scale are at moderate risk, and any patient that is 12 or less is put on high risk. Based on those protocols, there is a set of standing orders that will be implemented into the patient's chart, and the nurses will chart and document as those interventions are implemented. Completion of the protocol requires that every intervention is implemented within 24 hours, and nurses should talk to their nurse manager if any of those interventions are not able to be completed. And then Callie here is going to tell us about those interventions and why they're important.
So when a patient is admitted, if they're going to be staying for longer than 24 hours, they're going to be given an assessment called the Braden scale. And depending on the score, it's going to determine their intervention. So if the score is between 13 and 18, that puts them at a moderate risk, and they're going to want to be consulted with the nutritionist, and the nutritionist will give them a plan of care for adequate nutrition that will help decrease the likelihood of a hospital-acquired pressure injury or a HAPI. They'll also be given an educational bundle. This will teach them about the description of what a pressure injury is and how to prevent them, what the risks are, and just what the treatment looks like. They'll also have continuous orders of being repositioned every 2 hours. This helps to reduce the likelihood of a patient getting in a hospital-acquired pressure injury. Then they're also going to be given thorough skin assessments every shift, so every 8 to 12 hours, depending on what shifts look like at the specific hospital. And then if the score is less than 12, meaning the risk for a pressure injury is more high, then the pressure injury specialist nurse will be called on to the specific patient's case, and they can provide additional assessments, additional rotations, and treatments for the patient. So they just have a higher level of care if they're at higher risk. And then also, if the patient's at higher risk, they are given a viscoelastic mattress, and the specific mattress is put into place just because it can decrease the likelihood of HAPIs and makes it easier for the nurses to care for the patients. And then, like Sailor said, the nurse is responsible to complete all these actions within the first 24 hours upon admission, and then they're responsible to document all the things that they do for the patient. So now we're going to have a quick scenario of a patient being admitted to the ICU, and we'll go through the steps.
All right, Spencer, this is Carlita. She just got out of surgery. She was in a car accident this morning, and so she's paralyzed from the C4 down. She seems to be coming out of surgery pretty well. She's alert and oriented to most everything except for where she's at. I think she's a little bit confused about that, but vital signs are good, and you should be good to go.
Great.
See you later, Spencer.
Hi, Carlita. I'm going to be your ICU nurse today.
Okay, sounds good. Thanks. So, Spencer, knowing that she's going to be in the hospital for longer than 24 hours, knows that he needs to implement the pressure injury bundle. So he's going to start by giving her Braden assessment score.
So based on the Braden risk assessment chart, I'm going to go through and I'm going to assess her sensory perception, for which I'll give her a score of 2. I'm going to assess for skin moisture, which I'll also give her a score of 2. I'm going to assess for activity, which I'll give her a score of 1. I'm going to assess for mobility, which I'll give her a score of 1. Nutrition with a score of 3, and friction and shear with a score of 1. That's going to give me a total of 10, which is less than 12. And so I'm going to be initiating the bundled care for patients who are in the hospital with a risk assessment less than 12.
So this means he's going to go put this into the patient's chart, and he's going to implement the following orders. The first being a consult with a nutritionist for Carlita.
Hi, Carlita. I'm your nutritionist. I'm going to be behind the scenes making sure you're getting all the good nutrition you need to, because you're at risk for something we call the hospital-acquired pressure injury. Making sure you have good nutrition is just one of those things to help us make sure that doesn't happen. And so I'll just be behind the scenes making sure you're getting all the nutrition you need.
Okay, thank you.
The next step is Spencer presents Carlita with an educational bundle about HAPIs.
Hi, Carlita. I have a little bit of information here about the pressure injuries that the nutritionist was telling you about. We'll go ahead and read through this later together, but basically what it's going to do is it's going to explain to you what pressure injuries are and what your nurses and healthcare staff are going to be doing to help you stay healthy and not receive one while you're here in the hospital with us.
Okay, awesome, thanks. Additionally, the nurse and assistive personnel will consistently reposition the patient every 2 hours.
All right, Carlita, we're going to be repositioning you and doing a log really quick. So we're going to go ahead and move you over. 1, 2, 3.
Because she's at less than 12, she's going to have thorough skin assessments every shift and the implementation of a pressure injury nurse.
Hey Carlita, I am your pressure injury nurse. I'm just going to be here to assess your skin to make sure that there's no injuries going on and we can help improve any health concerns that you have, all right?
Sounds good.
All right, so I'll just go through it and look. Also making sure that there's a viscoelastic mattress to make sure that those pressure injuries are not forming.
Okay, thank you.
All right.
So with all of this care, she is hopefully at a low risk for pressure injuries, and we can prevent them overall.
All right, this is the new policy for the JACSS Memorial Hospital to prevent hospital-acquired pressure injuries for patients. Now that we've finished the presentation, does anyone have any questions?
Sweet, thank you all.
Sweet.
That's it.